We provide information on dengue virus, including dengue reduction, dengue symptom, dengue family treatment, and prevention.
Dengue. It is a mosquito-borne viral disease in the humans. It can affect anyone, but it tends to be more severe in the people with compromised immune systems. Dengue goes by other names also, including breakbone fever or dandy fever. As victims of the dengue, after having contortions due to the intense pain in their joints, muscles, and bone, and hence the name is breakbone fever. Also, the slaves in West Indies who contracted the dengue fever were said to have dandy fever because of their postures and their gait. If we talk about the pathogenicity of the dengue, then it varies from its mild to the most severe form. As the mild dengue fever have symptoms just like those of the flu. But the severe form of dengue fever, also called as DHF, means dengue hemorrhagic fever. It can cause serious bleeding and a sudden drop in the blood pressure, also termed as shock, and it can even cause the death of person. Now, moving next to the cause of dengue disease. Dengue is caused by the virus of Flaviviridae family, and there are four distinct but closely related serotype of the virus that causes dengue. And these four different serotype, they are termed as DENV1, means dengue virus serotype 1, DENV2, DENV3 and DENV4. These four subtypes, they are the different strains of the dengue virus that have 60 to 80% homology between each other. The dengue virus is a 15 nanometer virus enveloped with a lipid membrane. There are 180 identical copies of the envelope protein attached to the surface of viral membrane by a short transmembrane segment. This dengue virus has a genome of about 11,000 base pairs, and this genome encodes the three structural proteins named as capsid, PRM and E protein. Now, if we talk about the vector ecology, then as we know, the only vector responsible for the spread of this deadly disease is the female mosquito of the Aedes genus. There are the two species responsible for the spread of this disease, where the Aedes aegypti is the primary vector of the dengue virus spread, and the Aedes albopictus, another species, it is the secondary dengue vector. These Aedes mosquitoes breeds mostly in the man-made containers where they can find a still water. If we talk about their feeding habits, then the Aedes mosquitoes, they are daytime feeder, with the peaks are early in the morning or late in the evening time. And the interesting thing is that only the female mosquito sucks the human blood because it needs the proteins to feed for its larva. And the female feed multiple times between each egg laying period. Now, moving next to the symptoms. Incubation period of this disease is about 4 to 5 days. It means the time period between the bite of the infected mosquito to the onset of symptoms is 4 to 5 days and it can be maximum of 12 days. In the many cases, symptoms will be mild and may be mistaken for the flu or any other infection. Symptoms of this disease generally last for 2 to 10 days. And the symptom includes presence of fever, body rash and headache. And these three symptoms, fever, rash and headache, they are also called as the dengue triad. Now moving next to the severe dengue fever. A small percentage of the individuals who have dengue fever can develop a more serious form of the disease, which is known as DHF or dengue hemorrhagic fever. Moving next to the personal protection. Best method of the protection is to avoid the mosquito bites and to reduce the mosquito population. If we are in a high risk area of the dengue, then we should avoid heavily populated residential areas. We can use mosquito repellent indoors and outdoors of the house to prevent ourselves from the mosquito bites. A person can wear the long sleeved shirts and pants tucked into the socks. We should use air conditioning instead of opening windows to prevent the entry of mosquitoes inside our homes. We should also ensure the windows and the door screens are secure. And if any holes are present there, then they must be repaired. Plus, we should also use mosquito nets. Now, moving next to the treatment of dengue disease. So it's shocking that there is no medication or the treatment specifically for the dengue infection. For the typical dengue fever, the treatment is directed toward the relief of symptom. It means there is only symptomatic treatment. A person can use over-the-counter pain relievers to reduce the fever or headache or the joint pain. And for this purpose, acetaminophen or also known as the paracetamol outside the US areas and codeine may be given for the severe headache and for joint and muscle pain, commonly called as the myalgia. However, aspirin and the ibuprofen, they can cause the more bleeding and complications, and thus these two should be avoided. Now, moving next toward the vaccine of this disease. In the April 2016, WHO, which stands for World Health Organization, approved the Sanofi Pasteur's Dengue, which is a live recombinant tetravalent vaccine for the dengue fever. The Dengue can be administered as a 3-dose series in the people of 9 to 45 years of age who live in the areas where dengue is endemic. Dengue was very effective at protecting against the severe dengue, which can be fatal and thus preventing 93% of the severe cases. Vaccine is approved only for the people who have a documented history of the dengue fever. Thank you for listening.